Good afternoon, everyone. Welcome to the Health Professions Professor Chat. I'm Laura Laporte. I'm from the admissions office here at Fulton Montgomery Community College. It's my pleasure to welcome you here today. We're going to be discussing the various degree programs, and they are the Health Information Record Management degree program, Health Science, Health Studies, Nursing, and Radiologic Technology. So let me introduce you to our panel of professors today. Cullen Bailey, instructor, clinical coordinator, and radiologic technology. Hey, Cullen. Carlin Labatt, assistant professor and director of our radiologic technology program. Hi, Carlin. Charlene Dybus, assistant professor, business technology and applications. Hi, Charlene. And Eileen Casey, instructor of nursing and director of our nursing program. Hi, Eileen. Thank you all. For the participants, as the professors go through their discussion, you can participate by typing in questions in the chat function. So please type in your questions, and as the professors pause throughout their presentation, I'll read those questions and we'll get them answered. And with that, I'm going to turn it over to our radiologic technology team, Cullen and Carlin.
Hi guys, can everyone hear me okay? Perfect. So I'm going to talk a little bit about radiologic technology, some things that you will learn, some traits that are good to have if that's a field that you're interested in. And then Carlin's going to talk a little bit about potential transfer options that you guys might have and touch on a few other things that she wants to mix in. So traits that you want to have to get involved in radiologic technology, if that's a career that you want to select. You have to be very good with people. This is a health professions degree program, so you interact with patients at clinical sites. You have to be very good with technology because in the healthcare field, technology changes very fast. Just like our iPhones get updated versions each year, technology changes in the hospital setting, so you need to be able to accept change easily and vibe with that change. You have to be very good with anatomy and physiology, and you have to be strong in math and science. Those are typical qualities that we have applicants think about. And if those are things that you're strong in school, those definitely will kick you up a notch to get you ahead of the game in radiologic technology. So what is radiologic technology? It sounds like a big word. Basically, we utilize X-rays and deliver radiation to patients. It's not like dealing necessarily with cancer patients, so it's not strong radiation that we're using. But we take X-rays of patients to evaluate bones or any other disease processes that might be in the body. So we are the ones that take the images. A lot of people say, "Oh, you're reading the images and you're making a diagnosis." That's not actually the truth. We are the ones that position the patients, align our X-ray equipment, and take the images for the doctors to provide a diagnosis. So we deal very heavily with the patients. We interact with other members of the healthcare team, including nurses, transporters, administrative assistants. We communicate in the OR. There's various different pieces of equipment that you utilize. So some things that you'll learn physics. You'll learn some radiography physics concepts. You'll learn how to position patients. You'll learn how to have an appropriate bedside manner with patients. You'll learn about appropriate patient care techniques. You'll learn how to manipulate X-ray equipment in the lab. At FMCC's lab, we have a fully energized piece of equipment that students love. They manipulate the equipment before they go to the clinical setting, and students love that opportunity because they get to learn from their mistakes there before they go to the clinical site where they actually practice radiologic technology. So students tend to love that experience. It's a very, it's a close-knit group. We really do become a family. We've accepted as high as 20 students into our program before, and they interact with each other in the same classroom pretty much every single time we have classes. So you become a very close group. When our graduates are just finishing their requirements, and they left the program a family. So they always have somebody that they can go back to. We communicate like crazy. You always have somebody to essentially hang out with, and you talk about your what you learn all the time. So you learn, we said physics, we said patient care, we said positioning, also pathology. You learn how to analyze your images. Remember, x-ray is an art and a science, so you learn how to look at your images, and you can see how you can improve for future situations, future x-ray cases that you might do after. I don't know, let's see. That's in addition, so that's mainly the didactic portion. When we say didactic, that just means sitting in the classroom. We also have a full clinical experience course that students attend. When freshmen, they attend on Tuesdays and Thursdays, and those are for 8-hour shifts. And students love that class because they're interacting directly with the technologists at our clinical sites, and they're taking x-rays on patients with direct supervision from radiologic technologists. So students love those experiences. That's the meat and potatoes of the program, the clinical experiences. So speaking about clinical, we have many clinical site affiliates that we work with. So we have Ellis Hospital, Saratoga Hospital, Nathan Latour Hospital in Gloversville, St. Mary's Healthcare in Amsterdam, Cobleskill Regional Hospital, who's affiliated with Bassett Network, and we also have their Cooperstown site that we rotate students through. We have Multimed Emergent Care, Wilton Medical Arts. Who else? Oh, St. Peter's Healthcare, Albany Medical Center, Mohawk Valley Orthopedics. We have many clinical sites that we can rotate students through, and that's another thing that students love. They love the versatility. They love being able to go to a large hospital and then going to a smaller clinical site so that they can see what fits them best for when they want to get a job. Carlin, did you want me to talk? Was there anything else that you wanted to discuss? Does anybody have any questions?
Colin, there is a question. Can you give students a sense of what's a typical day for a rad tech student? I mean, what does your schedule look like? How many days are you at the hospital? Can you talk about that?
Yeah, sure. That's a great question. So when you get accepted into the radiologic technology program, as a freshman student, you attend classes on Mondays, Wednesdays, and Fridays. I teach the physics classes on campus, and that's from 8 to 9 on Monday, Wednesday, Friday. So that starts your day off. You're lucky you get to start your day with me. So you start with me, and then you have some classes with Mrs. Labat. She teaches the patient care courses as well as the positioning or the procedures classes. So those are typically, and schedules vary each semester, but usually from 10 to 11 and 1 to 2. And then you have one lab setting that I teach from 1 to 3, either on a Monday, Wednesday, or Friday. So and you schedule that lab with your advisor, and they're able to select the day for you, but then you finish your afternoon in a lab setting. So it kind of pieces everything together. You learn all of the didactic things, the classroom things, you learn it in lab, and then the next day you practice it at clinical. So Monday is class, Tuesday is clinical, Wednesday is class, Thursday is clinical, and then Friday is class again. So, So clinical, you would get one of those clinical sites. Carlin and I usually have a meeting, and we assign clinical sites based. First years, we try our best to accommodate students and get them to the clinical site that's closest to the physical address that we have on file. That's not always a guarantee, but for the most part, we try and do that. And then so that would be your freshman site. That's how that would work for semester 1 and semester 2. Then you complete a full clinical rotation over the summer, typically 9 weeks, and it's students tend to love that rotation because they're going to clinical every single day, and they piece everything together during that rotation. So they do 40 hours of clinical each week in the summer for about a 9-week span of time, and then you start off. Then you begin your senior rotation, which starts, that would essentially be fall number 2. And then we flip it a little bit. you have class on Tuesday and Thursday, and then your clinical rotations are Monday, Wednesday, and Friday. So we expect a little bit more. We have higher clinical expectations because that's what you're going to be now practicing in the field once you graduate. So that's a typical schematic or outlook of what the program classes and clinicals are like. Does that answer the question?
Absolutely. Absolutely.
Great.
Do you want me to add a couple things?
Of course. Please go ahead, Carlin.
Hi, everybody. So I guess what I can add is what can you expect when you get out of the program? The growth market right now is this job is expected to grow about 20% above the average. And that's based on technology. As technology progresses, more equipment is built and designed, and then the hospitals open up positions for people to run that type of imaging equipment. The starting salary right now is about a range of about $22 to $30 an hour, depending on shifts and where you work. So for a debt to income ratio, this education is a big value to the student, right? For the price of a 2-year education to get out and work, you're starting a salary per year around $50,000 and up, which is a great start in life. We just graduated 16 seniors, and 12 of them are already employed. We've spoke to several employers today, actually, that are looking for them to come work there. And what Colin said about our program that is a takeaway for you is that it's a small environment. So I think that we have a lot of fun. We're really a close-knit group. We have a club, and we usually are able to do some trips, of course, depending on what's going on. But we do fun activities. Students show a lot of personal growth in our program. They're bonded. FMCC as a whole is that type of campus. It's a campus where you can get assistance when you need it. Your teachers are available to you, and I think that's one of our strengths. Our Cullen and I's experience, I've been at St. Mary's Hospital. This is my 30th year of employment there, and Cullen also works there. I've worked at many other places, including Albany Memorial Hospital, Mohawk Valley, and several other clinics. So we bring a lot of experience to you in the imaging world, which is fun for us. We both still work out there, so we try to keep up with what you're doing. That's fun and challenging for us. As far as transfer opportunities, a lot of students come into the program and ask us about ultrasound, and a lot of students ask us, and I'm sure Eileen Casey will talk to you about this, the difference between us and nursing. How do you know which one you want to choose? We are heavily technology based, right? And I think Eileen would agree that when nursing is more, they have time for more patient care. They're doing more care based, more medication based, where we're running equipment. You know, our patient care contact is like 5 to 11 minutes per patient, and that's it. The patient goes on to their next thing. You know, and nursing, depending on what area of nursing you work, has a little bit different workflow. And I think probably more people hands-on than we do. We're heavily computer-based, so it's just different. And I think that you have to explore both professions to see which one fits your personality. A lot of people ask us about ultrasound. Ultrasound is a 1-year certificate program after you become an X-ray technologist. And our job is to take diagnostic X-ray pictures for the doctor. Ultrasound, you're running a machine using sound waves. So from an X-ray degree, you can do ultrasound, CAT scan, nuclear medicine, physics. You can go on to be a physician's assistant, mid-level provider. There's lots of different branches for us. We have an articulation agreement with SUNY Upstate, where you can get a bachelor's degree in 3 semesters. That's kind of a popular transfer. We also have a Boise State, which is an all-online bachelor's degree. So we do try to set you up with our career counselor and help you advance if that's what you choose to do. And I also have had the privilege of teaching in RadTech and teaching in the health professions on campus, and I taught ethics. And Cullen was a guest speaker for me, and I actually had I had a nursing professor come in. So that health professions is a really fun way to start your health career because it's an exploring program. We talk to people about medical coding, transcription, what are the entry-level jobs in the hospital, dental hygiene. We talk about all kinds of fields and the ethical values you need to possess to be in a healthcare related setting, whether it's doing coding or it's doing hands-on. So the health professions is a really good way to get your foot in the door at FM and explore career and learn about yourself. And I find that all the professors involved with that program are available to you also. And they will find you connections, right? You get to make lots of connections. They will find you connections. I know Charlene and I collaborated with a local doctor who was looking for an administrative assistant type of person. And we were able to fulfill that position for him. So there's a lot of connections you can make. It's a great place. FMCC. I was a student at FMCC also. It's a great place to be. Any questions?
I was as well. I'm an FM graduate as well. We can't get enough.
Yeah. Someone wants to get started with radiologic technology. As you mentioned, it is a competitive program. We are limited to anywhere between 16, 18, maximum 20 students. So it does make it highly competitive. What would be your recommendation for someone, they want to make a change, they're interested in radiologic technology, but they've got to get through the prerequisites? What would be your recommendation? And typically, do you see students spending maybe an additional year at FM completing those prerequisites? Talk a little bit about how do I get into this particular field if I don't even have any background in science or medicine?
That's a good question. And I think I'll say again that the health professions program is a great start. We find that 80% of every class approximately has been at FM or will graduate our program in a 3-year time frame. So they've come to FM, they take math over if they need a math refresher, and then they'll take a math if they need biology and a chemistry or physics. And we also allow those at a level that students can be successful, right? So they can take an essentials class to refresh and bring their grades up. If your grades, your grades from high school, or you have a college class that's too old for us to take, you have the opportunity and an available professor, available tutors to help you get the grades that you need. It's to get into our program, it is heavily grade-based, so you want to shoot for a B or higher in any prereq classes or co-req classes that you take. Getting a job in any type of healthcare setting will give you experience to present yourself. When we do our communication in our program, we do a communication assessment, a group type interview setting where we speak to you about the program and you speak to us. So even if you were a transporter, you worked in the cafeteria, pharmacy aide, any of those types of positions just help you understand healthcare in general. So that would be my advice, is to try to gain a position in a healthcare facility, look at the classes that you need and aim for a B or higher. And there's lots of resources that you can reach out. We have wonderful professors in the sciences that will help you. Does that
Very
answer,
good.
Laura?
Awesome. Very good.
Okay.
So I think we're going to move on to Charlene now. And
Yes.
Charlene, you're going to tell us about your program.
Okay, I'll be happy to. I'm going to talk about the Health Information Records Management Program, and that program is some of this includes some of the stuff that Carlin just mentioned. But I want to start by saying, obviously you're here today. You're here in this session today because you know that no matter where you go today, people are saying to you, talking to you about the benefits of a career in healthcare. I mean, really, everybody's talking about. There's a lot of reasons for that, a lot of things going on, aging a population and so on. But maybe direct patient care isn't for you. Maybe rad tech is too direct patient, maybe nursing is too direct patient, but you want to be part of this exciting field. I mean, because definitely it's exciting and it's growing. And so two positive things, exciting and growing. So then the health information records management program is what's for you, because you can be a integral, fundamental part of the healthcare system and patient care and by doing health records management. So our degree is an associate's degree, a 2-year degree, and we'll give you the skills you need to be very successful, in this industry. You can, this program is technologically intensive. You have to have technology skills. And I heard, Cullen mention that. And obviously, look at just what's happening right now with COVID-19. People are working from home, they're doing all kinds of things, and it's all based on knowing and being able to function in the technology that goes along with that. In addition to that, we'll give you all the courses that you need to sit for the coding certification exam, which Carlin just mentioned about coding. And a lot of people these days want to be coders, because lots of times coders can work from home and people like that. So that's something, if coding's for you, then you can do that. If coding's not for you, we still have a place for you. We're very flexible. This program is flexible. Obviously, what kind of courses are you going to take? Well, you're going to take medical terminology. You're going to take medical insurance. You're going to do essentials of anatomy and physiology. We have 2 coding courses, and that's what you need for that coding certification. To sit for that exam, you have to take those 5 courses, and we have them. So we're ready for you there. And also, you'll take some courses in the healthcare. You'll take healthcare ethics. You'll take introduction to patient care. You could do an internship. Most of my students love the ability to do an internship. You don't have to, but we offer an internship. And I'll tell you something, most of the students who do an internship, they're hired before they're done with their school. If they do well on their internship, then they have a job. So like Carlin mentioned, the Bureau of Labor Statistics, she talked about that. And in this program, the medical records and medical information technologists, they're expected to grow about 11% by 2028. And again, that's much higher than all other career fields. So I encourage you to check out that site. It's bls.gov/OOH, and you can do some research for yourself. It's really hard for me to put a dollar amount on what you'll earn, because there's just so many different career paths in this program. If you're a coder, you'll earn a certain amount. If you work in a doctor's office or what. So, there's a wide variety of pay scales. But one thing I do want to say, a couple of things I want to say. Number one, to our faculty, we're in touch with the local employers all the time. We ask them, we say, what skills do you want our students to have? What will it take for you to hire them? And then we come back and we make sure that we find a place for you to get those skills in our program. We want you well prepared to go forward. And I think that's critical and important. And I think that's true of all of these degrees that we're going to talk about today. In addition, it's a small program too. So, being a part of a small program has a lot of benefits. And one of them is that obviously you learn how to function in a team. And I think that's so important. Learning teamwork is probably one of the number one things that employers ask for people to be able to work as part of a team. And the other is that you will develop lifelong friendships. These are a small cohort of students. You have a lot of classes with them, and you really do develop those friendships that sometimes people think you can only get if you go away to school and live on a campus. But I'm going to tell you, that's not true. I still know that some of my students, and they even help each other get jobs after. They'll say, hey, guess what? Where I'm working, I have a job, come here. And so it's really cool. It's really nice. And your professors are going to know your name. They're going to know who you are. They're going to be able to help you get whatever help you need to make it through. If math's your struggle, science your struggle, we have somebody who can help you. And we want to direct you to those people. We want you to get the help that you need. So, that small program, small school feel, you'll definitely get that. And I I hope that you'll choose FM. And one other thing, like Colin and Carlin, I'm also an FM grad. So I'm back again. Can't get enough, as Colin said. So if you have any questions, feel free to reach out.
Charlene, we do have a question for you.
Okay.
Is there a demand for medical coders right now? And can I work from home as a medical coder?
There is a demand for coders. You have to be certified. That hasn't always been the truth, but now pretty much most hospitals want certified coders. Some will help you along the way to get your certification. They'll hire you if you have, and then help you get your certification. But there are places that let you work from home. Every place is different. I can't say for sure, you'll be able to work from home, but there are people who are coders from home.
And Charlene, just one more. What would you say are the top attributes for someone working in a medical office, medical records? What type of personality, what type of skills would someone be a good fit for this particular program?
Obviously, if you're working in a doctor's office and you're greeting patients and so on, you're going to definitely have to have, a lot of empathy. You're going to have to be able to be empathetic to them, to their situations. Lots of times people are ill, and when people are ill, there's a lot of things on their mind. You have to have attention to detail. I think that's really important that people don't realize, especially as a coder. If you want to be a coder, you definitely have to have attention to detail. And no matter what you're doing, you're handling people's health records. So attention to detail is something that's extremely important. And you have to be part of a team. Even if you're working from home, you're still part of a team. I don't think that, people tend to think, oh, I'm not going to, talk to anybody in my job. I'm just going to, work from home. But no, so you have to be a team player all the way around. I think those are important skills.
Good, thank you. And one question came up on the Facebook Live, actually, for the Rad Tech team.
Okay.
Student wants to know if we ever go to the alternate list to select students. Being it's such a small program, is there still opportunity if you were named to the alternate list? Is there still potential to get into the class for fall?
As in for this fall, Laura?
Yeah, like if you were
Yes.
an alternate.
Okay. Yes, we go to the alternate list every year that I've been at FMCC. So our program is fairly new. We graduated our first class in 2006. So we're not, as programs go, we're not an old program. And I've been involved with the program since 2008. And every year since I've been involved with the program, we've accepted alternates. We usually put about 10 students on the alternate list, 10 to 12, I would say. And sometimes we've accepted all the alternates. And sometimes we've accepted 1, 2, 3, or 4 alternates. But I've never been involved with this program where we haven't accepted an alternate student. And that's for multiple reasons. Sometimes people decide they want to go to nursing. They apply to both, they get accepted to nursing. Sometimes they get accepted to another program. Sometimes life happens, changes, and they're accepted, but they don't take the spot. And then we go right to the alternate list.
Thank you.
You're welcome.
Eileen, we're going to move on to nursing. So I'm going to hand the program over to you.
Wonderful. Well, thank you everybody for checking in with us and for chat with the professor here. I'm going to talk about nursing. Again, my name is Eileen Casey. So if you decide to come to FM and want to, or are considering doing nursing here at FM, what we're going to do for you is we're going to prepare for you, giving you, helping you guide you through to an AAS in nursing, which will make you eligible to sit for the NCLEX licensing exam to be an RN. So you will be eligible to be an RN after the conclusion of our program. So similar to the other healthcare options, you do need to have an idea of, you have to like science. You definitely need to know your anatomy and physiology. You have to be in awe and amazement to how fantastic the body is as it works through recovery and illness. how it adapts and how it heals. Technology is a huge part. We are using technology more and more in nursing. We are using it for great precision in managing patients with their illness and guiding them towards wellness. So technology, so if you like technology, it's a good fit for you as well. But I can't not talk about caring, because yes, nursing is so much about caring for patients. We are working side by side with patients for hours on end. And so you really have to be the type of person who finds caring as core to who you are. We're not solely focused on illness. So because you may have an opportunity to work with a woman with pregnancy and through birthing and caring of a newborn and so forth. So it's not always illness, but it is essentially a part of it for sure, but it's really about health. And so caring and guiding people through different points in their life, from beginning of life to end of life, is where nursing, is vital. So we definitely do more than just caring. We're huge on education. We really are focused on preventative, and we teach the students on how to communicate with patients, how to educate how to be a part of a healthcare team, because we have to work alongside our rad techs, and we have to work alongside the physical therapy and the physician, the dietitian. We are just one in a very large healthcare team that works together to get people to where they need to be. For nursing here, if you're thinking about nursing, you do not need healthcare experience prior to, but it is good if you've had some insight into, maybe some experience. We have students come to us all the time who say, I never thought about nursing, but then my aunt was sick and I spent a lot of time watching her as she went through her recovery, or my parents spent time in the hospital, or a good friend was, spent a little time in the hospital, and through their exposure to nursing, they really felt that they felt the calling through those experiences. So if you've had any of those opportunities and you've seen a lot of what nurses do. Certainly in this current environment, nursing is getting a lot of news exposure. And I can very much say that I'm very, very proud to be a nurse. Always have been, but even more so in the current environment. So so think about nursing. What will you do if you come to FM for nursing? We do the same. We have our didactic training and we have on-site training. What we also have is our nursing lab. So we have a nursing lab and we have a computer simulation room. So we can simulate patient experiences right here on campus to help students kind of practice without feeling the fear of, can I hurt anybody or do anything wrong? So we really have a lot of fun working in the nursing lab side by side with the students and helping them practice the skills that before they do go out into the hospitals or the facilities. And similar to Rad Tech, we also have agreements with area hospitals. So the students, through the course of their 4 or 5 semesters with us, will be spending time in different facilities, getting a little exposure to many opportunities in nursing as well. So they spend time in the nursing home. Of course, we spend a fair amount of time in our hospitals, but while they're there, you get exposure to the emergency department, the ICU, dialysis, cardiac cath. They get to spend time with a community health nurse, so they can go out and see what it's like to do the community health nurse aspect, which is completely different and so very unique and fulfilling in its own. They do, if I didn't say hospice, and we also, we work anywhere from 5 to upwards of 12 hours a week working in the hospitals or different settings, honing our skills that we've learned in lab and through our coursework. But also, like these other programs, we are very competitive. So definitely your biology, your algebra, you need a lot of strong science scores, math scores. So a lot of the coursework that can be done prior to actually enrolling or starting the nursing coursework, it really does make life a lot easier for nursing students to have gotten a lot of those work courses out of the, done ahead of time. So, but it's a very competitive program. So, but that's because it's such a great program. We also are small. We have a great faculty here in the nursing program, and we're all come with years and years of experience. I am 26 years as a RN at Albany Medical Center, and I'm still in practice. I work in the surgical ICU there because I absolutely love it. And so it is just, I'm very passionate about nursing. I'm passionate about education. So this is just like the most perfect job in the world for me. But the other faculty as well, the great thing about us is that we all come with such experience, and we all teach within our specialties. So we know what we're talking about. We really do have the experience to guide students to, all there is to know about nursing. And the beauty, I think one of the biggest selling points to nursing is just that it just opens the doors to so much. So again, you become eligible to be an RN. So what does that mean? Well, it means it is like a launching pad, because from there you can take that 1 degree of being an RN and you can work in so many distinct and unique different parts of healthcare, but you're still an RN. So we have, again, to the specialties of the critical care and emergency room. We have nurses working in maternity. We have our pediatrics, our neonatals. We have nurses doing flight nursing. We have nurses in education, clearly, but they're in lobbyists, they're in research, in advanced practice nursing, nurse anesthetist. Nurse practitioners, nurse management. We have nurses running, healthcare systems and being huge contributors to healthcare decisions and so forth. And that all started from being a nurse. So the RN is where you start, and from there you take it wherever you want to go. So this is, and they can all start here. We also have affiliations with other colleges. Many of the students do choose to come to FM or a associate degree program. I myself, I'm not an FM graduate, but I am a community college graduate for nursing, and I did the route on up through my advanced degree. But many of the students start practice after their 2 or 3 years here with us at FM, and they start their training for their bachelor's degree. So it is a current legislation has it that you do have to get your bachelor's degree within 10 years. And but it's great because while working, they're able to complete much of their coursework online with some of our hospital or other colleges that we have agreements with. So it really works very nicely for them. The job opportunities are obviously, there's a strong market for nursing, and the average median salary, if you use the same statistical site as Charlene had mentioned, puts nursing at the average about $73,300 for salary. Okay, so that is a start there for, that's where the average remains for that. And the growth is upwards of 12% plus. So our students do well. They do get jobs after they leave here. We have a very high pass rate on our NCLEX exam as well. So that is something that we are very proud of here. 90% of our students do pass the NCLEX on their first attempt. And for that, again, we are very proud. We exceed the state and national levels. And that's at least a part of nursing. There's so much about nursing, but does anyone have any questions?
Yeah, Eileen, a question came up. Someone's interested in nursing. They work full time. Can you work full time and be a nurse? Go to nursing school? I mean, how does that work? As people who like to get into that.
Yes, that is that's a very good question. And it is a challenge for many of our students that are faced with that. So yes, it can be done. It would require a person who can be very organized and good with time management, clearly. It's not easy. It is certainly not the time to pick up extra shifts and do more than you have to in the work. But if students are successful working full-time and going to school. Again, the recommendation is often that you get your prereqs out of the way before you start nursing school, and that even makes it more manageable. But it is not necessarily easy. Students have found as they've moved through the coursework, and it may get a little harder, that they've had to cut back on their work time to allow for, more studying and so forth. So, but it is possible. And the students, I'm sorry, and I know you want to say something, Laura, same idea here. We're small as well, and we work side by side with our students just continuously, and the students work side by side with each other to support each other. So, no one works alone as a nursing student, being successful and through getting themselves through the program. So.
Can you talk a little bit about the class? I mean, it's very common that we're seeing more adult students coming in and interested in the radiologic technology program, health records, as well as nursing. Talk a little bit about the student who's like, I don't know, maybe I'm just too old to go back to school. I'm going to be the oldest person in the class, kind of a thing. Enlighten them about how really education is timeless and what you're seeing in your classroom.
Absolutely. Excellent point. Yes, we go, and it's wonderful sometimes to have that, fresh out of high school. And then we've had people who have come back to school to become a nurse as a second career. They've actually retired from their first career and have chosen to return and take on, they've always wanted to do nursing, and now they're doing it just for the love of being able to do it. So it is absolutely timeless. And again, that kind of wide range of experience only kind of increases, it just makes for a better overall experience for everybody, because everyone has so much to contribute. But we have students of all ages and all backgrounds coming in to do nursing, and that's what I love. It's absolutely wonderful. But
awesome.
Yeah.
That was the last question I have. Does anybody have any other comments or anything else that they would like to share with our audience before we complete this session? Anything else? Okay. Well, hearing none, I want to thank all the professors for taking the time to provide such really great information, really insight into your program. So that was really, really fantastic. So thank you very much for doing that. And I want to thank everyone who tuned in today to watch the chat. Thank you for watching. And, if you're interested in the health professions, or maybe you're interested in another career path, we would love to hear from you. And the best way really to get a hold of us and to talk to us at this point, being we're not on campus, is to go to fmcc.edu. And what you'll find there is a site that will basically allow you to contact us, whether you want us to call you, you would like to have a virtual meeting, a phone appointment, we'll text you, email you, whatever the case may be, whatever you feel comfortable with. We'd love to hear from you and really get to know what your career goals are. So please reach out to us. We would really love to hear from you. If you like what you've heard and you're ready to apply for admission for the fall, we are certainly still accepting applications for the fall. Plenty of time to enroll for the fall. We offer a free application on our website, very easy to apply for admission. You only need to prove that you've either graduated from high school or you've earned what was formerly known as a GED to be accepted to the college. So it's a very easy and fast turnaround. And once you've applied and we've accepted you, our admission team are going to walk you through the next steps, which includes completing your financial aid, getting academically advised, all the things that you need to know to be successful at FM. So please, if you are interested, please reach out to us. We'd love to hear from you. And with that, I'm going to conclude this chat thank everybody for their attention, and have a great day.